in 5, 4, 3, 2, 1.
Ladies and gentlemen, we're discussing a topic of extreme clinical necessity. It is the approach towards an intoxicated patient. This applies to any patient presented to the emergency ward with an unknown intoxication. Firstly, the manifestations of intoxication is challenging even to most astute clinicians, especially when the patient is presented with altered mental status, or when there is no further history of intoxication. General guidelines include the recognition of a specific toxic syndrome, otherwise known as toxidrome. It's a routine pathway, although it is unfortunately not enough, as symptoms are often nonspecific, or in other circumstances they're masked by other conditions. The following are examples of common toxidromes and relative drug treatments.
Hypertension, mydriasis, tachycardia.
Furthermore, the diagnosis of toxic ingestion is divided into the following categories: history and physical examination, vital signs, ocular findings, mental status, behavior, and muscle tone. Firstly comes the history and physical examination. This includes clinical features mandating consideration of toxic ingestion. Secondly comes the vital signs, the anticholinergic and sympathomimetic substances that increase the heart rate, blood pressure, and temperature. Contrastingly with the organophosphates, opiates, barbiturates, beta blockers, and benzodiazepines. Thirdly comes the ocular findings. Substances such as the anticholinergics and sympathomimetics cause mydriasis. Fourthly and finally, mental status, behavior, and muscle tone. It is important to determine whether the patient is comatose, lethargic, delirious, confused, or alert. Some toxins cause seizures, others alter muscle tone. The following figure represents a surveillance of the routes of exposure for poisoning, conducted by the American Association of Poison Control Centers. The following percentages are 76% for ingestion, 8% for inhalation, 6% dermal, and 10% others. Table 2 represents a statistical analysis of the most lethal human toxin exposures. The analgesics leading, then alcohols, antidepressants, CVS drugs, sedatives, hypnotics, or antipsychotics. And lastly is the stimulants. So how do we really approach a patient intoxicated with an unknown toxin? Through the following. We have 3 basic routines done in the management of intoxication. Firstly comes the initial supportive therapy, also known as ABC. Secondly is the toxicology screening. Thirdly is the prevention of further absorption through MSS, gastric lavage, and activated charcoal. Supportive measures, which are the ABCs, stands for airway, breathing, and circulation. They are often required before confirmation of intoxication. Toxicology screening can identify a specific toxin for which an antidote is available, and in some instances it can quantify a toxin, allowing for titrated therapy. The syrup of Ipecac, which induces MSS, should be considered only in fully alert patients, and it's virtually never indicated after hospital admission. Contraindications to its use include poisoning with corrosives, petroleum products, or antiemetics. Gastric lavage is performed by instilling 200 milliliters aliquots of warm tap water until there is clearing of aspirated fluid. Stomach contents should be retained for analysis. The activated charcoal is a powerful inert non-toxic and non-specific adsorbent that irreversibly binds intraluminal drugs and interferes with their absorption. It is a particularly effective substance in binding with high molecular weight compounds. Table 15 represents the toxins or drugs not absorbed by the activated charcoal. Further management can be achieved through catharsis, whole bowel irrigation, enhancing elimination of the toxin through forced diuresis, and manipulating urine pH. The toxin chokers. Following is the famous antidotes. We got a variety of antidotes for drugs or poisons, such as N-acetylcysteine, which is an antidote for acetaminophen. We have got oxygen as an antidote for carbon monoxide poisoning. We got flumazenol for benzodiazepines. We got other means of removal of toxins from outside the body. In other words, extracorporeals. Hemodialysis, hemoperfusion, and hemofiltration. I'd like to thank you, ladies and gentlemen, for your time and attention. Thank you all.